Everybody here okay? I don't think I've ever spoken in front of this many people in my life before. I'm terrified. So I'm not sure how I got here. I was asked to do this, and I'm really happy to do it. But this is really not urology. I'll try to throw a few plugs in for urology here and there. But what I really wanted to talk about, and what I think is really, really important, is just, you know, I see this in my practice. I really think that we have an epidemic of sickness in our country, in the Western world. And people, our expectations of what your health should be, I think, have been really lowered. And what surprises me is how easy it is for people to have really, really excellent health, but there are some huge obstacles to overcome. So the topic of the talk is avoiding and eliminating modern diseases of affluence through whole food, plant-based nutrition. I'm John Huffer, and as Linda alluded, I'm a urologist, and I'd like to thank Michelle for having me here too. So I am not a professional researcher. I'm not a nutritionist. When I was trying to get into medical school, I worked in a nutrition research lab at the University of Colorado in Denver. We did stable isotope studies studying the absorption of zinc in the human digestive tract. But professionally, that's about all I've done. And put a few small like technique papers out. So none of this is any of my original thought. None of this is based on any of my original research. I'm just a guy who's really, really interested in nutrition. I seem to always have been really interested in nutrition. I think it probably started, I went to undergraduate at University of Colorado in Boulder. I took a nutrition class way back then, and you know, Boulder's kind of a loose community, and there was a lot of that kind of thing, you know, vegetarianism, veganism, you know, going on. So it's kind of been with me through the years, but I haven't really practiced, you know, personally, sort of what I think is heavy-duty, excellent nutrition until the last, say, 7 or 8 years. I read about nutrition all the time, and you know, what I have to say here is what I think is the truth. I kind of, you know, approach this topic with the attitude, you know, what is the very best way that I as a human being can eat? And I try to approach it with a very open mind. I mean, if the answer is eating a Philly cheesesteak, you know, I'd be the first one on board. But it's not. It's not. And one thing I'd say, though, is that you know, it's a real privilege working as a physician, because it really, you know, it's a unique position where you're just going through, you know, hundreds and thousands of patients. I've got like 20,000 patients in my electronic medical chart database, and I mean, you see all these diseases coming through, and you understand people's attitudes and things. And I mean, I think there's a real disconnect between, you know, what's happening in society and what people are capable of, and it's a really multifaceted, complex issue. And I don't have any ties to any industry or financial interests, anything like that. And I thank you all for coming here tonight. I'm overwhelmed. I thought I was going to be talking to maybe Dirk, but or Chris. But you know, this is a wonderful, wonderful community. We came here. We're coming up on 9 years, and you know, everybody's just opened their arms, and it just feels really good. I'd like to thank you know, The people at Fairbanks Memorial Hospital, I was brought up here on a hospital support agreement, and that really helped me get established. They're competitors, but I like to thank the Surgery Center of Fairbanks too. I think it's a great institution, and these are the entities that allow me to practice medicine. So I feel a lot of gratitude towards both of them. To all the patients, I see a few out in the crowd. You guys are wonderful. You guys have been really good to me. These people have no idea that I'm saying this, but I'd like to thank Michael Hambidge, Nancy Krebs, and Jamie Westcott. They're the ones I used to work with at the Center for Human Nutrition. My family and my wife especially. This is the family. Oh man, Alex must have done that when I wasn't looking. Okay. So very simple message here. Many modern health problems can be improved or cured by changing the foods you put in your mouth every day. And it just surprises me how few people are aware of that. There's a growing field in medicine. It's called lifestyle medicine. It's still a minuscule aspect of how we practice medicine, but it should be the primary aspect of how we practice medicine. I mean, the experts who look at this kind of thing as a profession, the professional researchers, I mean, they estimate that 80% of the disease processes that people suffer from and that we as doctors and healthcare providers treat are pretty much eliminated through nutrition and lifestyle. So, I mean, that, and I think it's probably true. I mean, even 80%, even if it's only 50%, I mean, that's a staggering number. And you think about the amount of money that we spend and the resources that we're wasting. I mean, yeah, a lot of people would be out of work if everybody was healthier and we didn't have such a mega health system. But I think everybody'd probably be better off and we could be doing other things. So, most modern medications that people are taking are given because of disease-causing foods. Most modern medications do not resolve the conditions that they're intended to treat. They just sort of mask the manifestations of the conditions. And the experience with this is just huge. And it surprises me how little this is publicized, but most medications become unnecessary. They become unnecessary and dangerous and counterproductive when certain foods are avoided or eliminated and replaced with unprocessed or minimally processed plant foods. So the best way for human beings to eat is what is often referred to as a whole food plant-based diet, whole food plant-based nutrition, plant-strong nutrition. It is the optimum diet for human health. And there are decades and decades of research, of evidence to back this up. So we have, large studies. They're historic studies, cohort studies, population-wide studies, epidemiological evidence, historical observations. Massive clinical experience that spans decades, published studies that indisputably show that a lot of illnesses just definitely get better when people start changing the way that they eat. And, this is becoming more and more common for people to run these kinds of studies. They're just building off of their predecessors. But, this kind of thing was known about in the early 1900s. And even, back in the 1950s, I mean, we knew that you can make type 2 diabetes just go away just by eating the right food. And then there's a lot of interesting scientific bench work. So when I was thinking about giving this talk, I thought, well, what's the best thing I can do? The facts, the statistics, everything, I mean, there's just literally, 10 Alaska ranges of this stuff. There's just too much. It's overwhelming. So I just thought, well, I think the best thing I can do is to encourage people, if you're interested, to look into this yourselves. And so that's really what I'm going to do. There are a lot of pioneering people who are working in this area that's kind of the point of my talk, is to expose you to these people and the topics that they're uncovering. So aside from all the science, clinical experience, blah blah blah, if you don't believe any of this, and you've got some health conditions, try it yourself, and you'll see. So I read about this all the time. I listen to podcasts, all kinds of things. The scientific data, it clearly, indisputably shows that for most people, the diet for optimum health is the whole food plant-based nutrition. While it's true that one size does not fit all, we're all a little bit different. Some people can take one medication and experience no side effects. Other people will have severe side effects. We all metabolize differently, and there have been studies showing that people will eat the very same food, and for some people it'll cause their blood sugars to spike. It might raise their cholesterol. Others it'll lower it. But those differences are generally pretty minor. Still, the overriding picture is that a plant-based diet is the best way to eat. So there's a couple words that I'm not that fond of. One is the vegetarian diet. So, a lot of times, let's say a guy comes in the clinic, it's like, doc, my thing doesn't work too well anymore. What can I do about that? Well, most guys, they want some Viagra, and that's fine. And, what I really want to tell them is, heart disease starts in the penis. It does. And if you're developing erectile dysfunction, that's a sign that your cardiovascular tree is compromised. So, most guys, they probably just want some Viagra and to get out of there. That's okay. I'm all right with that, But, I'd really like to talk to them about, this is a sign that your nutrition for years and years and years has been compromising your vascular system. So they say, well, what do I got to do? I say, well, you probably eat a lot of meat and dairy, and you probably have a lot of oil, and probably have a lot of refined carbohydrates in your diet. So, you got to cut out the meat and dairy. You mean I got to become a vegetarian? No. If you're a vegetarian, you're eating dairy products, and those things are really, really toxic. Well, you mean I got to be a vegan? No. You don't have to be a vegan. I don't like the word vegan because, a vegan diet is not necessarily a healthy diet. I mean, you can eat nothing but Lay's potato chips, and that's a vegan diet. And I'll talk about it a little later, but, probably the healthiest people in the world, they don't completely shun meat or dairy products, but they eat very little of it. And so I think that the best data shows that a diet that is at least 90% minimally processed whole plant foods and no more than 10% of it from meat, dairy, or highly processed food is the best way to eat. So, but the key point is little meat, dairy, eggs, oil, or simple sugar. What about olive oil? Olive oil is, it's not that good for you. It's an advertising campaign. So if you want excellent health, a whole food, plant-based diet is mandatory. You hear a lot about, well, nobody's ever talked to me about this. Why didn't anybody talk about this? And, I know my medical colleagues, I love them to death, but some of them hear about the way that I talk to patients sometimes about nutrition, and they're silly. It's cute, but it's silly. A lot of people just don't appreciate the incredible power that whole food plant-based nutrition has to make people healthy. And for those who are interested in something like this, there's very little to no support from the medical industry. Personally, I think our modern paradigm for the practice of medicine is insane. I mean, the way that we have started eating, I mean, it has changed so much over so little time. Our bodies are not built for this. And, pretty much everybody that I see over a certain age is on some kind of medication. And it's fascinating to me that, every day, like 10 times a day, I'm seeing a new patient, Mr. Jones or, Mrs. Hitchcock, do you have any medical problems? Oh, no, I'm pretty healthy. Okay. Have you ever had any surgery? Oh, I've had this, I've had that. Any allergies? Yeah, penicillin when I was a child, that's a common one. What about medications? Let's see. I'm on metformin and glipizide for my diabetes. I take lisinopril for hypertension. Oh yeah, I'm also on metoprolol. And they start listing off these medications, and it's like, oh, I thought you said, you were healthy. I mean, I don't say anything, but it's like, that's what I'm talking about. It just doesn't register with people, and we've set the bar so low. And, using lifestyle medicine is just not currently an integral part of the accepted medical culture. There is a widespread lack of knowledge and interest among doctors, and this causes a dismissive attitude. And, the reason is because it's not taught in medical school. Only like 1/3 of medical schools have any nutrition curriculum whatsoever. And, there was an interesting event in California where, some people sued the state or sued the state medical board, to get nutrition into the curriculum, and the medical board opposed it. Okay, and we can pick on doctors, but physicians' assistants, nurses, and other medical people are included too. And it's not a criticism towards people. It's just that this is just not widely broadcast. It's just information and culture that is just not widely disseminated. There's no morality to it. There's no intelligence or stupidity. It's the way it is. But I think the paradigm ought to change. It's definitely not taught in medical school or residency. I mean, some of the worst eating I ever did in my life was in medical school. I had a really good diet, when I worked in the nutrition lab, and I went to medical school, and it's like, oh, the drug reps bring you pizza every day, And in residency, I mean, yeah, it's terrible. More importantly, nutrition is not tested on the United States medical licensing exam, so there's really no incentive to know about it there. It's not on any specialty board exams unless they may have a lifestyle type board exam. I'm not sure. And then, the other thing is probably, patients aren't filing enough lawsuits. And one of the guys I'm going to talk about here later, he wrote a book. His name's Joel Furman. He wrote a book called The End of Heart Disease. And I mean, in his book, he says, if you go see a cardiologist because you've got chest pain, and the cardiologist says, well, you need a stent, without telling you, did you know that thousands of people have taken up whole food plant-based nutrition and reversed their disease, and they don't need a stent? I mean, his point is, you should get sued. And he's probably right. So, and then there's such a big thing these days, oh, we're practicing evidence-based medicine. No, we're not. You know, the evidence is that people get really healthy when they eat whole food, plant-based nutrition. And, you know, we're just spinning our wheels. We're just, you know, chasing our tails. I'd like to make a special mention of Dr. Wren. He's a cardiologist at Fairbanks Memorial Hospital. He's the only doctor I know of in Fairbanks who really actively advocates this kind of therapy. It is therapy. It's a drug. I spoke with Dr. Cobman. He's a local orthopedic surgeon about this, and I mean, he jumped on board, and I was really impressed by that, you know. Oh, I need to make a public apology to Charles Newberg, local radio host. He had me scheduled for an interview about this talk last Friday morning, like 8 o'clock. And I looked at this text at 9 o'clock. It's like, so you're scheduled for 8:05. So apology to Charles if you're here. And then finally, Scott Looper, he's a naturopathic doc here in town. And he's had me on a radio show a couple times over the past few years. I was actually on it. He no longer does it. He's just moving on to other things, but he had me on his last broadcast. But, you know, really, there's very little of this going around. So our health is getting worse every year. Cancer rates have been climbing steadily, at least from about 1915 to 2005. They may be leveling off a little. But, you know, Richard Nixon declared war on cancer, you know, whenever he was in office, in 1970 or something like that. And, you know, we've spent billions and billions of dollars, and cancer is winning. Cardiovascular disease and hypertension is the norm. And again, Mr. Jones, do you have any medical problems? No. Well, what kind of medications do you take? Oh, I take a beta blocker, you know, I take a hypertensive, you know. It's the norm. Like, people just think, well, this is how we grow up and this is what happens to us. No, it's not the norm. And, you know, I think everybody knows we're inundated with this news all the time. Childhood diabetes, adult obesity. These rates are soaring. Luckily, there are some spots of hope, but, you know, in general, these things are getting out of control. And, you know, infections are common, and, you know, part of this is the food industry. I mean, just like dousing our food supply with antibiotics and breeding superbugs. So it's not only how people eat, but it's how we produce food also that's a real problem. People aren't as active either. And again, our standards, our bar is pretty low, I think. So, you know, this is a really, really complicated issue. And there are many reasons why. And it is our problem. You know, it's not, you can't blame any one person, any one group, any one country. You know, it's humanity's problem. But, you know, from the personal standpoint, people are very comfortable with their identities, you know. We like to love ourselves, and we like to be who we are and love that and honor that. So, you know, most of us, I mean, I grew up in a household where, you know, I was making ice cream sundaes, you know, at night, and eating hot dogs and chicken and burgers, you know, pizza. God, I drank gallons and gallons of milk. You know, so many of us are growing up that way, but it's actually a toxic food environment. But that's what we're familiar with. That's our culture. You know, and depending on kind of which subculture you come from, most modern cultures are not really practicing good nutrition. A lot of times you talk to people about their nutrition, and, you know, face it, the food that you eat gives you the building blocks that produce the cells that produce your body, and your food is you. and I start attacking your food, it's like a personal assault on you. So people get really personal about this. They get touchy about it, and it's amazingly emotional. I look at these blog sites where some of these practitioners I'm going to be talking about here in a minute, who are really, they're trying to do humanity a favor by bringing this to light, and you got these internet trolls who are just like lambasting these people, and calling them liars. And why is that? There's also very powerful socioeconomic forces at work here. It is a fact that industries, the meat, dairy, big agriculture, and junk food industries, they're very powerful. And they've got a lot at stake. They're humans too. And we've all got the drive to survive. And so, they're doing what they can to influence public thought so that they can sell their products. They're trying to influence public policy. And they're even trying to influence the direction of research and the findings of research. And this stuff is all well documented. And then there's a certain amount of narrow-mindedness, and when I'm in clinic, when I really first started getting into this about 2010, and I got to credit Dr. Zuckerman with that. I was having Dr. Zuckerman over for dinner, and we had salmon, It's like, Jeff, have some salmon. Nope, not having any. I said, why? And so he told me, I just read this book called Prevent and Reverse Heart Disease. So he talked to me about it, and I said, okay, so I'll read it. So I read this book, and it's been this way ever since with me. But when I first learned about this, I was fascinated. And I thought, my God, there's so many conditions that are just so nebulous. There's no cure, there's no treatment, there's no effective treatment, and all of a sudden it's like, well, there's so many things you can treat. I was so excited. Started talking to people about it all the time, and I think I really turned people off. You get too evangelical and too militant about it, and so I've learned to tone it down, because really it's just a waste of air in most cases. But I do find that there is a lot of narrow-mindedness about it. And in clinic, when people ask me, why am I making these stones? What can I do to stop making stones? Well, it's primarily a dietary issue. You need to eat the right diet. And I call it the hand. The hand goes up. Oh, I eat a good diet. Everybody thinks they eat a healthy diet. But I think what most people consider a good diet is not a good diet. Why'd you get stones then? Why are you on these medications? Why do you have these problems? Because you shouldn't. People have a fear, lack of knowledge, and a lack of understanding of, what is this? Is this like a communist conspiracy? They don't have any experience with it. And, there are very few people practicing this kind of thing, promoting this kind of thing. And there's a certain amount of unpopularity to it. And, it's like, oh, you self-flagellating, thug. You don't want to enjoy life? Well, yeah, I do, but, there's different ways to enjoy life. And so people are afraid they're going to get banished by the tribe, too. Whole food, plant-based nutrition is the most powerful, effective solution to most modern health problems. It's an unpopular message, but it's not about morality. It's our problem. It's not about religion. It's not a political thing. When I'm talking about it here with you, I'm not trying to lambaste anybody. Really, my point here is, I don't expect 10% of you will go out and start doing this. I really don't. I'm realistic about it. But, for those who do, my point here is to point you in the right direction. And like I said earlier, there's not a lot of support in the medical community for people who want to do this. And also, there's not a lot of support from your social peers, from your, from your tribe. There's not a lot of support because most people aren't into this. So it's challenging. It's very challenging. So disease is not inevitable. You have a choice, and it always amazes me how people think that it is inevitable. So these are the major diseases: heart disease, stroke, lung cancer, infections, smoking, barbecue, colon, rectum cancers, Alzheimer's, type 2 diabetes, asthma, soreness, stiffness, arthritis, medications, high blood pressure, heart disease, dementia, stroke. All these problems. Oh my God. You mean all of these things are related to diet? Yeah, you bet. It's inevitable, right? We're getting older. It's just part of aging. It's a normal part of life. No, it's not. So how do people who are interested, and if you're not, no problem, but if you are, more power to you. It takes, in this setting, it takes self-motivation. And what's really important is self-education. And you have to read widely because you see so many things that are contradictory. And you need to find sources that are very steadfast in trying to pursue the truth. And it's, if you're interested in doing this, it is a lifelong learning process, which is very worthwhile. It's not like you just convert overnight. Now, if you're sick, if you're really sick with disease, and you start doing this, you'll see very, very rapid changes. And in fact, you'll see changes so rapid that it can be dangerous. And so if there's anybody here who's considering trying something like this, and you're diabetic or you're hypertensive and you take medications, you need to do it under close supervision from a physician. Because if you start eating this way and you're taking diabetic medications, you're going to drop your sugars through the floor. Or if you're taking hypertensive medications, you're going to drop your pressure through the floor. You got to go easy because it's so powerful. You have to have an open mind to do it. You have to be open to it. You can't say, I already know everything. There's nothing more for me to learn. Those people who do this, they're just stinking liberals, hippies, communists. Just, open mind. You got to be committed to a lifestyle change, and you got to understand that there's going to be opposition to what you do. There's going to be, people who try to tempt you to get off the path. Oh, just have a little bit here, it's not going to hurt you. I eat this way, and I go through that all the time, even under my own roof. Like I said, you need good sources of information, and if you want to do it and it seems overwhelming, just you don't have to do it all at once. You don't have to jump off a cliff. Just take one step at a time, and that's why there are people who have initiatives like the Meatless Monday. Big deal. Just don't eat any meat on Monday, to start, or jump off the cliff. But just do it. So, like I said, I've been doing this probably for 7 or 8 years now. And I thank Dr. Zuckerman for introducing me to prevent and reverse heart disease, because that got me started on this path. When I first came to Fairbanks and started practicing, what I do is very stressful. You do a surgery on somebody, and you got trained to do this thing, and you can do the same surgery 100 times on different patients, and 99 of them, go perfect, and one of them, you screw up, or the patient has a complication for some other reason, and we sit there and just beat the crap out of ourselves, Or, I'm just like I'm just so stressed for time. But when I first came up here, I mean, my blood pressure was like, you know, I'd be in the PACU and I'd ask the PACU nurse to take my blood pressure. It's like 170 over 100. It was like, whoa. You know, and I was a little heavier. And that was in, you know, that was in 2008. And a couple of years later, and, you know, it was like that for a couple of years. And a couple of years later, you know, I got turned on to Dr. Esselstyn's work, and you know, I was just amazed, and I'm just so grateful that I found that. But why do I do it? I do it because mainly I want to be there for my family, not only just physically, but I want to try to stay mentally intact. And you know, dementia, I mean, more and more the research is showing that dementia and like heart disease are one and the same. But there's some amazing research going on about this that I'll touch on a little later. I don't want to get a heart attack. I love to run, you know, and when I go running, you know, I push myself really hard. Like, you know, sometimes I do intervals, and what I try to do is get so that when I finish, you know, it's like every cell in my body is just sucking for air. It's like, I need some oxygen. But, you know, if you've got compromised vascularity, it's easy to give yourself a heart attack, and I don't want to do that. So, you know, Dr. Esselstyn, Dr. Ornish, Dr. Furman, these guys, they will swear that you can be heart attack proof. So I try to be heart attack proof. I don't want to get dementia, don't want to get cancer. You know, the link between cancer and nutrition is also indisputable and totally underappreciated. For not only for prevention, but if you end up with cancer, I mean, there's amazing studies just showing the power of nutrition to fight cancer. And it's probably, you know, I tell patients in urology, I think the most powerful thing you can do is change the food that you eat. And we'll talk about that a little later too. I don't want to get arthritis, okay? Don't want to get infections. Do I get infections? Yeah, I mean, I got a tooth abscess a couple of years ago. That was terrible. But, you know, I used to get 3 or 4 colds a year, and now I get like one every, you know, year and a half or 2 years. I mean, I've really noticed that. It's because I try to eat according to Dr. Furman's plan. Yeah, I don't want chronic pain. I get patients in all the time. You know, I got this pain. It's like, okay, let's get a CT scan. Well, CT doesn't show anything. Yeah, but it's just killing me. You know, what is it? What is it? I don't know. I don't know. You know, it's probably your diet, but, you know, I'm not going to say that because you'll think I'm crazy. But it probably is. And there's millions, not millions, there's thousands and thousands of stories of people with just chronic pain who make this change and it goes away. I mean, it's true. Degenerative bone and joint disease. You know, stones. I look at CT scans all the time. You look at people's, you know, their vertebral column. They got these little projections coming off their backbones. You know, their bone density is really thin. You know, this diet is terrible for bones too. I don't want to take medications. I want to be active when I'm old, and I want to, you know, enjoy my retirement. And you hear so many people saying, I don't want to retire. You know, Joe Blow retired and he was dead 1 year later. So these are a few of the authors that, if you're interested in this, I would recommend you check these guys. I think that probably my very favorite is Joel Fuhrman. I left a little stack. I'm sorry. It was like 15 of these. I printed off these authors and some websites and stuff. You know, I had no idea this many people are going to come. So maybe if you got a neighbor with one of those things, you could use your phone, take a picture. You can take a picture here, whatever. But these are some of the people. And this is kind of by no means a thorough list. It's just scratching the surface. And I think if you do one thing, go to foodrevolution.com. And every year they have a Food Revolution Summit. and they interview several leading edge experts in these areas, and amazing interviews. The interviews are conducted by John Robbins. Does anybody know who John Robbins is? So he was anybody ever heard of Baskin-Robbins ice cream? He was the heir to the Baskin-Robbins fortune. His father started that company, and John Robbins, he walked away from it. He went to Vancouver Island, lived off $500 a year for a while, and he wrote Diet for a New America. He wrote Healthy at 100, I don't know, some other books. A really amazing guy. And by the way, his father became a vegan, because he had a heart attack and had to heal himself. So John Robbins gave birth to Ocean Robbins, his son, and they conduct these interviews, and they're really worthwhile listening to. So I call this the #1 buzzkill in Western civilization. And why do I say that? It's because I think most people, they, whether you go to college or not, or you work, you're a teenager, you graduate to your 20s and 30s, you work your butt off, and then you get to this more golden age, 40, 50, 60, and you're like, yeah, I did it. I did it. I'm feeling good, and then all of a sudden, So about 610,000 people die of heart disease in the United States every year. That's 1 in 4 deaths. It's the leading cause of death for people of most ethnicities, including African Americans, Hispanics, whites, American Indians, Alaskan Natives, Asians, Pacific Islanders. It's second only to cancer. So it's huge. So this is the book I was alluding to, Dr. Caldwell Esselstyn. Very interesting guy. He was on Olympic rowing team, just super overachiever. He was a endocrine surgeon at the Cleveland Clinic, just a big deal. This is probably the ER. Oh, sorry. Hey, honey, I'm giving my talk. Yep, I gotta go. Bye. Okay. Can't ignore her. So this guy was a hardcore surgeon at the Cleveland Clinic, but he had some disease in his family. I mean, just read his book. He tells you the whole story. He had some disease in his family. He said, what can I do to improve health care? Studied it intensively and said, well, the societies where people have no heart disease, they have cholesterols under 150. I think she's calling me again. I don't know. So he basically, decided that, if we want to try to treat heart disease, we need to try to emulate these cultures, these societies where we don't find heart disease. And he points out, he calls cardiovascular disease the paper tiger, a paper tiger. It's a toothless paper tiger that need not exist, is what he says. Cardiovascular diseases claim more lives than all forms of cancer combined. 50% occurs as sudden cardiac death, so your first warning sign. Other manifestations of cardiovascular disease, involve obstructive clots or, massive hemorrhaging, but an obstructive clot, if it goes to the heart, it causes a heart attack. It goes to the brain, it causes a stroke. It goes to the lungs, it causes pulmonary embolism. It goes to the bowel, it causes ischemic bowel. It's all the same thing. It's just this thing that goes whoop, and it plugs up your artery. The tissue becomes ischemic. And this kind of thing is also responsible for arrhythmias, fatal or non. And so, lots of people die from this without any warning. And it's estimated that, a very small percentage of this is like genetic or mechanical anatomic. he says, "My message is clear and absolute. Coronary artery disease need not exist, and if it does, it need not progress." And that was the point of his study. So we spend more, well, yeah, this is probably a couple of years ago, $250 billion on heart disease. Most of it is just for temporary relief of symptoms, you know, stents, and the workup. Almost all interventions do nothing to cure the underlying disease and prevent its development. So his study, he recruited 23 men and 1 woman around 1985, and these people were kind of the worst of the worst. You know, he got his referrals from his colleagues at the Cleveland Clinic, you know, who said, you can't have any more stents, you can't have any more bypass. And he got a few others, like one of his colleagues was a 45-year-old surgeon who had just finished operating, and he was sitting in the dressing room going, "Oh my God, my chest hurts," you know, and he found out he had really bad advanced coronary artery disease. And so he took these people and he put them on a vegan diet, a healthy vegan diet, I mean, he just showed remarkable results. He showed that you can reverse cardiovascular disease. You can stop its progression. And, you know, at the time, it was thought that, you know, this doesn't exist. It can't be done. And even to this day, you know, after he proved this with his patients, even to this day, people still deny that you can do that. It's like, no, he did it, you know, and he's done it like, after this, he's done hundreds and hundreds of more patients and studies and shown that, yes, it is repeatable. It happens. Use plant-based nutrition, reduce cholesterol to under 150, and sometimes he used statins to achieve that level. His rule was nothing with a mother or a face. If it swims or walks or flies, you know, don't eat it. No meat, poultry, or fish, no dairy, no oil, not even olive oil. And, you know, he goes into depth about why that is. Yes to grains, legumes, lentils, vegetables, and fruits. And there are some aspects of his diet that I don't necessarily agree with. I think, you know, he may have let a little bit too much simple carbohydrate in there in some cases. But in his study, his original study, no requirement for exercise or meditation. He just simply wanted to show that the nutrition is what makes the difference. And during his recruitment process, there were 6 patients that they just didn't get it, and they said, "There's no way I can do this." They gave him the hand. You know, they wouldn't comply. So he sent them back to their cardiologist. But he comments on how those patients did at the end of the study 12 years later, when, you know, all of his patients had thrived, and, you know, these guys didn't do well. In his study, 1 patient died and from an arrhythmia, but he showed these incredible drops in their cholesterol and some pictures that showed that their artery occlusion had been reversed. And this was a big deal at the time. And then almost simultaneously, Dean Ornish was doing these studies, UCSF, same kind of deal. You know, this plant-based diet. He's really into the stress reduction, you know, meditation, yoga, that kind of thing. So he includes that, but he pretty much showed the same thing. So these guys did, you know, 2 landmark studies, you know, kind of debunking the idea that you know, everybody has to get coronary artery disease, and once you get it, you know, you're stuck with it. That's what people thought, but no, it's, you know, the earth is not flat. So he's written some books, and down at the bottom, the one Spectrum is interesting because, you know, in that one, it's not like, you know, black and white. You're either with us or you're not. You know, it's like everybody's an individual. You know, do what you can. You know, have a meatless Monday. If that's all you do, great. But he kind of approaches it from that angle. And he's got a good website, so I encourage you to visit that. So Ornish was Caldwell's contemporary. first, he called his the first and only program scientifically proven to reverse the progression of heart disease. And he and Esselstyn kind of famously treated President Clinton, with lifestyle medicine. And Clinton, as far as I know, is still going at it strong. Clinton had a bypass in 2004, and of course he kept eating the same food, and of course he ended up getting a couple stents in 2010. That's what happens. That's what happens. I hear so many times, well, how's your cardiovascular? How's your heart? Oh, it's fine. I had a heart attack, but I got a stent. I'm good now. It's not true. Ornish's program was the first to be covered by Medicare, which is huge. And Ornish has done some other interesting studies. He's moved on to other things. He did prostate cancer studies showing that diet can actually reverse low-grade prostate cancer. And he did some studies showing that you can reverse dementia through nutrition. And does everybody know what telomeres are? So they're the little caps on the end of your DNA, and they kind of indicate how much time you have left. So when they get short, your time is short. When they're long, your time is long, barring a Mack truck or something. So he and somebody else, I can't remember her name, but she got a Nobel Prize for it. They showed that adopting whole food plant-based nutrition actually lengthened telomeres. This guy is legendary. T. Colin Campbell, he wrote the China study, and then a sequel called Whole, Rethinking the Science of Nutrition. So he was a guy, by the way, Esselstyn grew up on a dairy farm. T. Colin Campbell and Esselstyn did a lot of collaboration. Campbell, he grew up on a dairy farm. His father had a heart attack. He was, gung-ho, like when he was a young man, he was going to find a better way to feed the world. He was going to, just pump out some animal protein and stamp out starvation. A very intellectually honest scientist. He's earned great accolades in his career, but his research led him down this really unexpected path. How am I doing on time? Right? Okay, I gotta shut up here. So basically, read his book. I mean, through his studies, he found out that the most powerful initiator and promoter of cancer known to man is animal protein. So he showed through Occam's razor, the scientific method, that you can turn cancer on and off like a light switch by manipulating the amount of animal protein in the diet. And he got flogged for this. He got flogged. And his second book, Whole, talks about this, professionally, like what happened to him. Really interesting. John McDougall, the guy's a legend. He's basically, he had a stroke when he was a medical student because he just ate, just garbage. And he started out as a plantation physician, and he observed on these plantations, these Japanese, Chinese, Filipinos. It's like, wow, these old generations, God, these guys are healthy. They're like 90 working in the fields, and their kids are like, fat and diabetic. What's going on here? And so he figured out, oh yeah, and I had a stroke. So he figured out that connection. He's practiced medicine, for 3 decades now, promoting, lifestyle. That's his wife, Mary. They've written a bunch of books. This guy's really interesting, David Perlmutter. He wrote those books. So the basic, really interesting finding that he has promoted is that your gut sort of controls the inflammation in your body. And inflammation is a huge problem. It's recognized as the basis for, most degenerative diseases, Alzheimer's, MS, Parkinson's, as well as diabetes, coronary artery disease, cancer. And according to the World Health Organization, it's the #1 cause of death worldwide, causes more deaths than war, accidents, trauma, all that. And so inflammation in the body is determined by the permeability or leakiness of the lining of the gut. And so the idea is, you've got bacteria in your gut. Okay, should I? Okay, what should I do? Okay, all right. If anybody walks out, I won't be offended. So these are little projections called villi, and this is a cross-section of the intestine. And the villi are there to increase the surface area for absorption. And then upon these villi are microvilli, which further increases the absorption. And so the microvilli have cells. So if you look at it really close in a microscope, you can see that you got cells, a single layer of cells kind of stacked next to each other. And those cells are joined by some things called tight junctions, gap junctions, etc. And the health or the integrity of that barrier, and you're really, when you're eating, you're taking the environment and passing it through your body. Your digestive tract is basically part of the world, and everything between your digestive tract and your skin is you. And so your digestive tract is incredibly important for keeping the world out and selectively bringing in what it needs. So you have bugs in your gut. They have to be there. They've been there for eons and millions and millions of years. They're incredibly important, but you got to have the right kind of bugs. And that apparently is dependent on your diet, on the kind of food you eat. And if you eat the wrong kind of foods, you get the wrong kind of bugs, and those bugs somehow cause the tight junctions to become leaky junctions, and you got lipopolysaccharides, which are the covering of gram-negative bacteria that escape into your body, into your bloodstream, and your immune system goes, oh my God, there's an invasion, and you get this inflammation. And so, that's why people who just have this diffuse, vague pain, I just hurt all the time. I've got rheumatoid arthritis, I got arthritis, I got myalgia, I got tendinitis, that's why they hurt. They've got this leaky gut and this just chronic inflammation. And so it's been found, that this is a basis of all these disorders. This guy's a neurologist, so, he's studying brain disease, and he's like, this is what's causing these brain diseases. This is the gut. To me, it's just fascinating. A healthy gut microbiome, that's the big buzzword now, heals the lining of the gut, alleviates disease. And so, you can read about those studies. Dan Buettner, he wrote The Blue Zones, really interesting guy. When he was a young man, he bicycled like across Asia and Africa and all over, probably from Alaska to South America, something like that. But then he took on this project with the help of National Geographic, and these guys did really meticulous science, to make sure that the people they were studying were as old as they were, through documentation, and they found these 5 places where people live to be incredibly long, and they avoid these chronic degenerative diseases. And so they said, okay, well, what's their secret? And so, to make a long story short, one of the places was Sardinia, Okinawa, Southern California, Loma Linda, Costa Rica, and Ikaria. I don't know if I'm pronouncing that right. And so they came up with the 9 things that were common to all these cultures, and one of them is the plant slant, avoid meat and processed foods. And that's kind of where the 10% thing comes in. These people are not going, should I take a daily supplement? Should I go to the gym? No, they're just living their lives the way that they know how to live, because that's how they live. They're not trying to follow any special diet plan. That's just what they do. That's just what they know. But it just so happens that most of what they eat is, minimally processed plant foods. They eat meat once a week, maybe at the most, usually like once a month, just for a celebration or whatever. They may have a little bit of fermented yogurt or fermented dairy product. And, a lot of them drink wine. But, they've also got very nice, close-knit communities. They got very good social support. So that's kind of the basis of their longevity. And Dan Buettner has got this project going around the United States. He's starting to establish these blue zones in different cities. He's recruiting governments and local community leaders to establish blue zones to make changes. And they've had some incredible success stories, like stamping out childhood obesity, or at least severely decreasing childhood obesity. Oh, and one interesting thing that I've been trying to practice lately, stop eating when your stomach is 80% full. It's really interesting. And you do that, and it's like 20 minutes later, you're like, yeah, God, I am full. If I had kept going, man, I would have, packed. And you should try it. Michael Greger, he's another really interesting one. Oh, yeah, as a matter of fact, so he has a website called nutritionfacts.org. Which is, I recommend just looking at it. It's entertaining. But you see some, he has this website, he says, because there's about 2,000 papers coming out every year, and he reviews these websites so that you don't have to. And he just makes little videos and makes these little vignettes that are really easy to understand. Yeah, he puts a slant on it. This guy is a freak about, plant-based nutrition, but he is for a reason. His grandmother was one of the first Pritikin patients. Pritikin started a plant-based nutrition program in, it's like the 1970s, and had incredible results. And his grandmother was one of the first patients, very, very sick lady, and she, was expected to die within a year or two, and she ended up living, I think, like 30 more years. So that was his experience that compelled him to become a doctor and compelled him to go into this area. Interestingly, he lectures all over the place. When Dr. Cobden got on board about plant-based nutrition, he's like, oh, we got to get McGregor up here, or not McGregor. I keep saying it, Greger. We got to get Greger up here. So he was going to bring him up. And he charges like a $5,000 fee or something. But interestingly, he donates every fee he earns, he donates it to charity. He doesn't keep any of it himself. So this guy really, really walks the walk. So read this book. It's interesting, How Not to Die. He talks about these 15 most common killers in the United States. He goes through all of them, talks about the nutrition. Second part of his book, he talks about what to eat, how to fix it, why you should eat it, why it's good for you. I get a lot of questions, about fish oil. If you will indulge me, can I read something from his book about fish oil? Okay. Is fish oil just snake oil? Question mark. Thanks in part to the American Heart Association's recommendation that individuals at high risk for heart disease should ask their physicians about omega-3 fish oil supplementation, fish oil pills have grown into a multi-billion-dollar industry. We now consume more than 100,000 tons of fish oil every year. But what does the science say? Are the purported benefits of fish oil supplementation for the prevention and treatment of heart disease just a fishtail? A systematic review and meta-analysis published in the Journal of the American Medical Association looked at all the best randomized clinical trials evaluating the effects of omega-3 fats on lifespan, cardiac death, sudden death, heart attack, and stroke. These included studies not only on fish oil supplements, but also studies on the effects of advising people to eat more oily fish. Are we going to get kicked out of here or what? Okay. You just tell me what to do, okay? what did they find? Overall, the researchers found no protective benefit for overall mortality, heart disease mortality, sudden cardiac death, heart attack, or stroke. What about... Uh-oh. You're going to have to drag me kicking and screaming out here. What about for someone who had already had a heart attack and is trying to prevent another? Still no benefit was found. And he annotates these with the studies. Where did we even get this idea that the omega-3 fats in fish and fish oil supplements are good for you? There was a notion that Eskimos were protected from heart disease, but that appears to be a complete myth. And I was reading another source about this, and it's true. Some early studies, however, looked promising. For example, the famous DART, D-A-R-T, trial from the 1980s involving 2,000 men found that those advised to eat fatty fish had a 29% reduction in mortality. That's impressive, so it's no wonder the study got a lot of attention. But people seem to have forgotten about the sequel, the DART-2 trial, which found the exact opposite. Run by the same group of researchers, the DART-2 trial was an even bigger study, 3,000 men, but this time participants advised to eat oily fish, and particularly those who were supplied with fish oil capsules had a higher risk of cardiac death. After putting all the studies together, researchers concluded that there was no longer justification for the use of omega-3s in everyday clinical practice. What should doctors do when their patients follow the American Heart Association's advice and inquire about fish oil supplements? As the director of lipids and metabolism at Mount Sinai's Cardiovascular Institute put it, given this and other negative meta-analyses, our job as doctors should be to stop highly marketed fish oil supplementation to all our patients. Iatrogenic, that means caused by, healthcare providers. And serious, it's serious. Stay the hell out of the hospitals because they're dangerous. It's a big problem. Guys like Dirk, and you gotta watch out for him. No, I'm just kidding. Dirk is an excellent nurse. He's awesome. He's a good guy too.
So fish oil is not good for you?
Well, apparently, but I'm going to talk about, I'm going to bring up Joel Fuhrman here at the end. And, Fuhrman, he talks about the long-chain fatty acids, DHA, EPA, and actually cites some studies where some vegans have been found to be deficient in these long-chain fatty acids. Some people are able to manufacture them adequately on a vegan diet, but others aren't. So he recommends, either getting it tested or supplementing for these. But he does not like fish oil. He likes algae-based. So this is a fascinating book that I recently finished reading. And I got onto this by listening to the foodrevolution.com summit. So this is a PhD who has made it her life's work to study patients who have survived cancer when everybody said they were going to die. Okay? And her question is, why aren't we studying these people more closely? It's like, she just notes that, it's like the medical establishment is just basically ignoring this, but, they have probably something amazing to teach us. So she wrote a book called The Radical Remission, Surviving Cancer Against All Odds. And she says a radical remission of cancer occurs in the absence of Western medicine or after Western medicine has failed to achieve remission. Her interest in alternative medicine began as a Bachelor of Arts student at Harvard, later became the sole focus of her PhD at the University of California in Berkeley. In her thesis, she traveled around the world, 10 countries, saw 50 alternative healers, and interviewed 20 radical remission survivors. And then after she became a PhD, she kept working in this area, and she's talked to well over 1,000 people now who have survived cancer. And she's also started this radical remission project where she actually wants people to write in and say, yeah, I've survived this, or just contribute to that community. So she, in her studies, she mentions, finding like 75 sort of general factors that a lot of these, patients had. But when she ran an analysis on it, she was able to distill it down to 9 common factors that all of these radical remission survivor people had. And she'll say herself, probably, one of the single most important ones is radically changing the diet. The other ones were taking control of one's health, following your intuition, using herbs and supplements, releasing suppressed emotions, increasing positive emotions. And you really should read her book. I mean, the things that they talk about are just fascinating. Embracing social support, deepening spiritual connection, having strong reasons for living. And as far as radical diet change, she says the majority of the people that I study all tend to make the same 4 dietary changes. They are greatly reducing or eliminating sugar. And she points out that cancer cells, metabolize glucose about a rate like 50 times higher than a normal healthy cell. And they're obligate glucose consumers. Reducing meat, dairy, and refined foods, greatly increasing vegetables and fruits. Eating organic foods and drinking filtered water. I don't know if eating organic is necessarily true or not. What I've seen is, yeah, there are definite benefits, and probably, all of our food should be raised that way, but conventionally raised crops are okay. They don't have that much pesticide on them. That's what they'll have you believe. Finally, Joel Fuhrman, a really interesting guy. Former world champion figure skater, and he and his wife Lisa, they were in the Olympics and they won some big deals. He's a board-certified family practitioner who specializes in preventing and reversing disease using nutrition. He's like Dr. McDougall, and he's written a bunch of books. I think his books are great. I try to adhere to this guy's advice more than anybody else. He promotes what he calls a nutritarian diet. And the basic idea is that for every calorie you eat, you should get the maximum amount of micronutrients. He says, don't worry so much about the macronutrients, the protein, the fat, the carbohydrates. Don't eat simple carbohydrates, but eat lots and lots of complex carbohydrates, starch and fiber, but your immune system thrives on micronutrients. And he wrote Super Immunity. And I get a lot of women in the clinic. They get sent to me because they're having urinary tract infections all the time. And I've come up with this little list of things that I try to remember to tell all of them that hopefully it won't involve antibiotics, but one of them is as much as possible try to eat this way, and I don't really say stop the meat and dairy and stuff, but it's like just pile on the vegetables and the fruits, and be kind to your gut bacteria, because the urinary tract infections come from the gut. And when your gut environment is benign, you're going to have less urinary tract infection. Oh, and you should read McGregor's book. I mean, he's got a fascinating story about tracing E. coli bacteria from a women's health clinic where they're coming in going, oh, my bladder hurts, and they get a urine culture, and they check the DNA of these bacteria, and they trace it all the way back to the slaughterhouse where they had these chickens, and there's like feces spraying all over the place. And then they find those same bacteria in these women's kitchens, like all over the cabinets and the sink, all over the place. Oh, and another story. So this book, Fasting and Eating for Health, the last one there, his story was, when he was actively figure skating, I guess he injured his ankle. And, the thing was just trashed. and he couldn't compete anymore. And he went to all these surgeons. He's like, help me, and nobody could help him. He finally went to this one guy, and he said, okay, well, this is what we're going to do. We're going to take a needle, and we're just going to stab your ankle like 100 times, and that ought to fix you. And he's like, well, I think I'll pass. So his father had gone to this place, and I can't for the life of me remember it. It was in San Antonio. It was like a medical compound, medical retreat where, the primary Sidney Sheldon or something like that. He would treat people through fasting, and so Joel Furman, after seeing all these doctors, nobody could help him. He went to this place and he fasted for 40 days, water fast only, and his ankle got better. I mean, it cured his ankle, and he went on, to be this great figure skater. And so, for that reason, he's made this part of his practice is fasting. It's like, fasting, he says that if you really want to supercharge your health, eat a whole food plant-based diet for 3 to 6 months. Just load up on those micronutrients. And then, some people will go on this diet, and they may start out just obese. And, it's like, well, they're losing 2-3 pounds a day, and typical expected, progression. I mean, it's just amazing, When people are obese and they go on a diet like this, I mean, the pounds just shed away effortlessly. I mean, it's an expected response. But sometimes people are a little heavy, they're like, the weight loss curve goes like this. And it's like, God, I just can't get rid of that last 10 or 20 pounds, I'm still carrying it around. And so he puts people on a fast. He'll put them on, 5, 10, 15, 20-day fast. Has to be very closely medically supervised. But he also talks about how this is so powerful for people to overcome autoimmune disorders like, SLE, lupus, rheumatoid arthritis. I mean, a whole host of problems. So something interesting to try. And, I read his book, and I was like, wow, that's pretty wild. It's like, God, I don't know if I could. I tried fasting for like 3 days, and it was, it's pretty rough, like trying to live in the world and work and stuff while you're fasting. But my family, we went on vacation over spring break to Switzerland. It was last year or the year before. And, I decided, okay, this is the only chance I'm going to get. I'm going to do 11-day fast. So, I started like on Thursday when I was still working, so I fasted for 2 days working in clinic, and then we had the whole next spring break, and then in that week, and I fasted that whole time. And I got to tell you, it was amazing. It's like you get through the first 2 or 3 days, and it's like, wow, this isn't so bad at all. It's incredible. You just drink water, and I got down to like 150 pounds, and I don't want to be that thin, but it's not that bad. So what I like about Furman, he is heavily science-based. He's cured thousands of people with advanced diseases purely through aggressive nutritional intervention. And anybody these days who says this stuff is malarkey, I mean, you're just not, you're just not looking in the right places, or you're listening to the wrong people, because, these are just a few of these people who have shown this stuff, and it is just so true. And he's another guy who says you eliminate heart disease, not only reduce heart disease, you eliminate it. Aggressive nutritional intervention, he says, is about 100 times more effective at preventing and reversing heart disease than stents and bypass. And these weak dietary measures that, conventional, like the American, whatever the Cardiology Association is. He's also shown that diabetes can be eliminated by proper nutrition. And this is the thing that just kills me. I see so many diabetic patients. It's like, you don't need diabetes is wicked stuff. I mean, it is wicked. It is so bad. And you don't need to have it. And you can get rid of it in like 2 or 3 weeks. And we knew this back in the 1950s. And I remember seeing like posters. Oh, we're going to have a bicycle race, and we're going to raise funds, to help pay for research to find the cure to diabetes. What? We already know it. We already know the cure. Maybe not everybody can get cured. And there's type 1 diabetics. They can't be cured, but when they eat this way, the studies have shown their insulin needs are severely, severely reduced. He talks about, he and Esselstyn, they talk about the Mediterranean diet. Yeah, Mediterranean diet was great. The Lyon study, I mean, they showed a reduction in risk of, heart attack by, 40%. But, these guys are like, big deal, we can reduce it by 100%. So, the Mediterranean diet, I mean, allows a lot of oil, a lot of refined carbohydrates, bad stuff. His thing is, and this is one reason why I try to follow what he promotes, because he's got this acronym, G-BOMBS. And it's easy when you go to the grocery store. You just say green leafy vegetables, beans, onions, mushrooms, berries, seeds. Okay? And there are so many recipe books out there, so many recipe books. You don't need to become a chef. I mean, the way I do this is when I have some time, I'll make a few recipes, and I just learn some sort of general principles about what works, what tastes good. But, overwhelmingly, like most of the time, I just wing it, and I love the stuff I make. I have this love affair with the food that I eat. So, in conclusion, modern degenerative disease is widespread, it's growing, and it's accepted as inevitable and normal in our current toxic food environment. It is not inevitable, nor is it normal. It is uncommon when you're eating good, nourishing food. Whole food, plant-based nutrition irrefutably prevents, arrests, and reverses degenerative disease conditions. And with the indisputable efficacy that's been demonstrated in clinical studies, laboratory studies, epidemiological studies, the safety and affordability of lifestyle medicine, the modern medical establishment is pursuing an irrational course, and a lot of it is just, it's run by, profit. I mean, I am incentivized to keep you sick. I want you to get kidney stones. I want you to have ED. How am I going to work otherwise? No, I'm not being serious. But that's how our system is set up. Relatively few doctors, programs support patients in making these necessary lifestyle changes. And you have to educate yourself. It's not effortless. It takes effort. And it can actually be lonesome, and, people may ridicule you. Yeah, whatever. Whole food, plant-based nutrition is the most powerful protection against available the modern degenerative diseases. And I see a couple people here in the audience who are sort of living proof of that. And, I commend you guys. You have no idea how happy it makes me to see you do this kind of thing. Would either of you like to say anything? I won't say who you are. If you don't, that's fine. All right, well, I guess that's it.